During this week, I had an experience with a patient that was diagnosed with schizophrenia, and it was clear that you could see like the symptoms of the schizophrenia while we were interviewing her. She had disorganized speech, grossly disorganized behavior. She had some negative symptoms like affective flattening, and she would explain some of her delusions that she would have. And it really showed me like how you have to be sensitive to the patients, and really like during your interview process you really have to take it everything that they're saying into consideration, and that this patient truly believes that those things are happening, especially in terms of the delusions and hallucinations, and to just like be respectful of what they're going through because of their mental health issue. And she was a schizophrenic. This case increased my understanding of the psychiatric nurse practitioner's role because I got to experience and see how like a acute state of a schizophrenic is, and how it's important as the psychiatric nurse practitioner, the provider, to do a thorough interview, to be empathetic with the patient, and to really consider everything that they're saying and make sure that you can associate their symptoms with their diagnosis. I feel like my strengths during that interview, I felt like I stayed calm. I was empathetic with the patient. I was as understanding as possible with the patient as well. I would say that my limitations are probably that I probably was like a little tense and apprehensive because I've never really, I guess, seen somebody in that acute state of schizophrenia. So I think just being more comfortable around people with acute states of their mental health disorders was probably one of my limitations. So during this interview of this schizophrenic patient, I will apply that to future situations, and just making sure that I ask the proper questions, I take everything into consideration, and then I make sure that I understand how those signs and symptoms align with the diagnosis that the patient is currently dealing with.